This week on HealthScan Weekly, focusing on indoor air quality, establishing a mental health routine, and the end of mask mandates for ride-hailing companies. Our first story, the Biden administration releases guidelines to improve ventilation. These new guidelines are aimed to reduce the spread of COVID-19 by focusing on improved ventilation and indoor air quality. The new Clean Air in Buildings Challenge is the latest initiative from the White House aimed at mitigating the spread of COVID-19. It is a call to action for building owners and operators to assess their indoor air quality and make improvements. The Environmental Protection Agency has published a best practices guide for improving air quality and reducing the risk of spreading dangerous airborne particles. Our second story, how 15 minutes of mental health hygiene can change your whole day. Much like washing your hands or brushing your teeth, establishing a routine for mental health hygiene can go a long way to prevent issues in the future. Just spending 15 minutes a day focusing on mental health allows for a refreshed baseline and a mental reset. Taking time to reset your mental space at the start means that the stressors of the day aren't piling on top of an already overwhelmed system. Mental hygiene practice also lowers the levels of cortisol in the body, which not only lowers levels of stress, but can improve well-being later in life. Our final story, after the government mask mandate was struck down by a federal judge, ride-hailing services promptly dropped their own mask mandates. Ride-hailing services joined many airlines and other transportation services in making mask wearing optional. Both riders and drivers for Uber and Lyft no longer are required to wear masks while inside of the vehicles. Both companies have said that local regulations would supersede their own rules. This has been HealthScan Weekly. We'll see you next week.